you know, our metrics continue to decline slowly in Mecklenburg County. Our positivity rate has dropped out of the red zone into the yellow at 9.1%, which is great news. We still have 267 cases per 100,000 population in Mecklenburg County, which is still very much in the red. So we know that although our numbers are moving in the right direction, this is a crucial time for us. We need to continue our efforts that have brought these numbers down. We know that there are a number of new variants being recognized in the United States. And we also know that as more cases are continuing to happen in our country, the possibility of mutation and change and more variants continues to go up. So we've really got to have people to continue the measures that we know make a difference right now. There's not enough vaccine for us to get comfortable. We're continuing to vaccinate as quickly as we can with the vaccine we have available to us, but we've got to continue to wear our masks appropriately with your mouth and your nose covered, fitting closely around your face. We've also got to make sure that we are socially distancing and that we really are restricting our activity in the community. So staying home when it's not necessary to be out and making sure that you're avoiding high-risk situations. We continue to focus on equity with our vaccines, making sure that we are getting vaccines out to all people in our community, especially those that are disproportionately affected. And just to let you know that we have had roughly 45 community-based clinics today in Mecklenburg County. 26 of those have been done by the Mecklenburg County Public Health, and the others from our other vaccinating partners, our healthcare organizations. So with that, I'm going to turn it over to Dr. Sullivan.
Thank you, Gibby. Good afternoon, everyone. And I'm going to, again, provide a brief update about vaccines for Mecklenburg County Public Health. Right. So first, for some quick numbers, through the health department, we have now administered over 29,000 total doses of vaccine, with over 20,000 first doses and almost 9,000 second doses. Again, we continue to vaccinate individuals in Group 1 and Group 2 as per current North Carolina Department of Health and Human Services prioritization guidance through a combination of appointments at our Bojangles and Medic sites, as well as off-site locations throughout the community. As you are aware, we had challenges last week with delayed shipment of both our first and second doses, but we were still able to honor the overwhelming majority of our appointments and planned community events. And while smaller than initially intended due to shipment delays, we were even able to still hold very successful events at the Camino Center and Reeder Memorial Baptist Church over the weekend. Due to shipment delays, approximately 1,000 second dose appointments did need to be postponed, but all of those appointments that were postponed have been rescheduled for this week and will be honored. We are also scheduled to receive an additional 2,925 doses of Pfizer this week. And unfortunately, we are again hearing that there may be delays in the shipment due to the weather, and we'll be monitoring that very closely. Currently, we will be able to use the shipment that arrived on Saturday to continue to provide vaccine services, and we will keep the community promptly informed of any challenges or delays. And planned events for this week include multiple second dose clinics in the community, as well as first dose community events at Lake Norman Community Health Center during the week and another church event this weekend. In addition, I just wanted to highlight two key notes. First, we opened additional appointment slots this past Friday for the end of February and beginning of March. And due to an announcement from the governor the day before, we knew childcare and pre-K through 12 staff were working in person became eligible for those appointments that fell on February 24th and later. We saw an overwhelming demand for appointments, which we know resulted in challenges with our online appointment system, and our staff worked as hard as we could to address it during the day. We continue to work to be as responsive as possible to all calls, emails, and voicemails that we continue to receive. We do now have a large number of individuals on our wait list, the majority of whom are educators, and we work as hard as possible to schedule appointments as allowed by vaccine availability and prioritization guidance. I do want to note also, though, that we remain committed to providing access and vaccine appointments for individuals in Groups 1 and 2, including our residents over the age of 65. And we strongly encourage any resident in Group 1 or Group 2 who's not been able to secure an appointment yet to check online, call our hotline, or join our wait list, and we'll reach out as quickly as possible. We did have a large number of educators who signed up for appointments prior to February 24th, on dates prior to February 24th, despite instructions about when eligibility began, and we'll be working with those individuals to place them on a waiting list or reschedule their appointments. This should create some additional availability for groups 1 and groups 2, and again, we encourage groups 1 and group 2 individuals to reach out to us. We are also working hard to ensure various options for additional appointment availability for our child and pre-K through 12 staff in the near future, and really appreciate everyone's patience with this process. In addition, we are really excited to announce that today we are rolling out a new form or website for organizations and individuals in the community to request to co-host a COVID-19 vaccine clinic. These community-based clinics that Gibby referenced earlier are part of a broader effort by Mecklenburg County Public Health and our local other vaccine providers to ensure equitable distribution of COVID-19 vaccines, specifically among low-income, racial and ethnic minority, immigrant, refugee, homeless, and other vulnerable populations in Mecklenburg County. These requests will be closely monitored and prioritized in accordance with our vaccine equity plan, including specifically using our vaccine delivery location data to identify areas with gaps in vaccine delivery and or uptake, with a particular focus on serving communities disproportionately impacted by COVID-19, underrepresented in COVID-19 vaccinations, or at highest risk for COVID-19 complications. While this event request form will be managed by Mecklenburg County Public Health, we will be collaborating with our hospital systems and other enrolled vaccine providers to maximize the number of prioritized vaccine event requests that we're able to fulfill. And the link to submit this form is available on our website at mecnc.gov/COVID-19. And that's all I have for now.
Thank you, Dr. Sullivan. First question today is Tina Terry, WSOC TV.
Thank you so much for doing this and for taking my question. I'd like to ask, how many people in Mecklenburg County do you estimate are in group 2 and 1 combined? And of those, how many people in those groups do you estimate have been vaccinated thus far? And then my second question, how important is it for people in groups 1 and 2 who've not yet signed up or made an appointment to be vaccinated to do so before we move on to group 3?
I'll start out, and then I'm sure Dr. Sullivan will want to say something about this as well. One of the challenges that we have in looking at these numbers to determine, especially in group 2, how many people have been vaccinated, is the fact that most of our long-term care facilities were vaccinated through the federal program with Walgreens and CVS, and that data has not been made available to us. So that's a percentage of that group that has been vaccinated that we don't have any data on. And the other challenges that we have with these groups is that sometimes we attempt to have concrete numbers about how many people actually fit in these groups, but that number is not always available to us as well. So really truly understanding all of the healthcare providers that could be eligible in group 1 is challenging. The thing that helps us understand where we are with this is when we open up appointments and see how many people actually are still looking for appointments. We get a better feel for whether we've done a good job of vaccinating this group or not. We also know that with the governor's decision to move forward with group 3, that we aren't going to completely finish groups 1 and 2 as we move into 3, but we will continue to work to make sure that we have priority slots and appointments for those folks that still are in those groups that are seeking appointments. So Dr. Sullivan, do you have anything else to say about that?
No, I think you summed it up really well. I think I would just add, when you talked about how important it is, and one of the reasons we wanted to stress this today is there is a reason that groups 1 and groups 2 were prioritized, either based on risk of exposure and direct care for COVID positive patients and or risk of complications. And again, we really are encouraging everybody to get vaccinated when they are eligible. We know the impact vaccines have. We know the effectiveness of COVID-19 vaccine and how important it is for everyone to get vaccinated. And so we really want to encourage individuals in groups 1 and groups 2 who have not yet been vaccinated to reach out to us, and we will work with them to get them vaccinated as quickly as possible as allowed by vaccine supply.
Next question is Alex Shabbat, WCNC.
Hi, thanks very much for taking the question. I appreciate it. It's about CMS teachers going back to school today, some of them, and vaccinations. And CMS had requested 40 for some of their staff a couple months ago, but obviously that hasn't happened yet. I know Union County schools had also been able to work with their health department and was able to secure some vaccine for their teachers. I'm wondering was that considered in Mecklenburg County, and why was it ultimately decided not to do that here?
Alex, that's a great question. It's come up any number of times. The situation that we understand in Union County is that prior to the shift and the change in priorities that happened from the state, Union County had already made appointments for a number of teachers, and they decided to honor those appointments even after the governor changed the priority listing to focus on 65 and up before getting to teachers. So they decided to go ahead and honor those appointments that were made. Mecklenburg had not made those appointments by the time the governor made the change. And at that point, we were following state direction. We're still following state direction on priorities. So we have seen this happen in a number of counties with a number of different populations. Decisions are being made at the local level about how to prioritize. But again, we continue to get specific guidance from the state that we need to stick to the state's priorities, and that's what we're doing in Mecklenburg County.
And just a quick follow-up, if I could, because I actually just heard from the state as well, and they said they're giving some flexibility to local health departments depending on supply and demand over what groups to give it to. That said, has the health department considered or believed that teachers should be or should have been on earlier?
Well, the flexibility that we've been given from the state is that we could stay in groups 1 and 2 and not go to group 3 yet if we felt like we had a lot of people in group 1 and 2 that hadn't been vaccinated yet. The decision here was to go ahead and to move into group 3 as we're continuing with 1 and 2. But as far as I understand in the conversations I've had directly with Dr. Cohen, is that is the flexibility that's been provided to the counties, not to move into other parts of group 3 at this point. So that's where we are.
Thank you. Appreciate it.
You're welcome.
Next question is Brett Jensen, WBT Radio.
Hi, guys. Just curious, a couple quick questions. One, in terms of, again, these teachers, Dr. Sullivan, you said the teachers, basically try to jump ahead of the line before the February 24th group 3. In terms of trying to make sure that those slots are filled up with 65 and older for group 2 prior to then, how challenging will that be to try and get these people in? Because I know if my mom had to try and sign up online, it would be a disaster. And so how do you try and get to these people who aren't really tech savvy to let them know that there are going to be spots available?
Yeah, and I think just to clarify, we recognize that the timing of when the appointments were made available and the timing of the February 24th definitely did result in some confusion. And I think we're just working as hard as we can to make sure that everybody has appointments or is on the wait list in accordance with North Carolina Department of Health and Human Services guidance. So specifically related to groups 1 and groups 2, I think we fully recognize that for many people, the challenges of signing up online or even knowing what phone number to call are things that we need to address. And so we are looking through multiple avenues to get the information out. So whether it is through events like this, we also have a specific designated community engagement team, which is health department staff that works directly with our community providers. And we've been getting out information to them about various options that includes not just scheduling an appointment online, but calling our hotline, sending us an email, and or joining our wait list. And we have staff that are working through all of these avenues to identify individuals in groups 1 and groups 2, and again, working to see if there's an available appointment. We also are working with our community leaders and other organizations directly to get that information out. So I think, again, through multiple avenues so that we really can make sure that everyone has access.
All right, great, thanks.
Next question is Claire Donnelly, WFAE.
Hi there, Claire Donnelly from WFAE. Thanks for doing this and thanks for taking my question. So I'm wondering how many teachers mistakenly signed up for appointments before February 24th and how many of those, how many need to be rescheduled? And then I'm wondering how that happened. Was the confusion on the part of teachers, or I mean, basically how did they get appointments ahead of time, yeah.
Yeah, so I don't have the specific numbers, and we know it wasn't an overwhelmingly large number. And again, we are working to address it kind of on an individual basis. I think we knew that we had opened up appointments that began, kind of before the February 24th date, and did indicate on our website that educators, so again, childcare workers and pre-K through 12 were eligible for dates on or after February 24th. And so I think some individuals, again, recognizing some of the confusion, signed up earlier than that. We did not intend to cause any confusion. This all happened quickly, and we're working as individually directly with those individuals to correct that issue.
And then just a quick follow-up. So how many of the appointments that were available to teachers, post February 24th, how many of those available appointments? I think it was around 3,200. Do you know a percentage? How many were educators, childcare workers, as opposed to those in groups 1 or 2?
Because this is still kind of an ongoing situation, I don't have those exact numbers right now.
Next question is Paige Peroso, WBTV.
Hi there. Thanks so much for taking our questions today. I kind of have a two-part question having to do with contact tracing. One, how many contact tracers does Mecklenburg County Public Health have? And are you still in need to get more due to caseloads? And then the second part having to do with schools and contact tracing. Is there a gap in, I guess, case count of people under the age of 18 between the Public Health Department and CMS due to possible unsuccessful contact tracing? And if that is true, I guess if you have the gap in case count.
So currently, I'm not sure exactly how many staff we have working in contact tracing, but I will tell you that we've gotten specific guidance from the state on where to focus our efforts. And the guidance we received from the state was consistent with what we were doing here in Mecklenburg County. I will tell you one of the priority groups that we focus on with contact tracing are those individuals 18 years and younger. And when we have those conversations with them, so we do multiple follow-ups with those families to make sure that we're being in touch with them and that they're understanding whether if it's a case, the isolation requirements, and if it's a potential contact, what that means. So we're having conversations with them about contacts, but if we learn that they've been in the school within the last 14 days, we're also engaging the school in that contact tracing process. So right now, we feel like we've got a pretty good system in place. And again, this is priority for us to make sure that if a child or a teacher has been in a school setting, that we are making sure that we address the potential contacts so that they know that they need to quarantine for the required period of time. So that is our process right now. It is working well, and the school system's working with us on that.
This is Tina with WSOC again. Can you tell me how many people are currently on your vaccination waiting list right now? And did I also just hear you say that the state gave you the ability not to move forward with group 3 vaccinations, but that you chose to do so? Thank you.
Yes, the state did say that we had the flexibility if we felt like we had too many people left in groups 1 and 2, that we did not need to move forward with group 3. It was encouraged by the governor that we vaccinate teachers and staff as well as our child care workers. But we were given the opportunity to stay in groups 1 and 2 if we so chose. Because of the numbers that we've been able to vaccinate with all of our vaccination partners, and the ability with some of the vaccine that we're getting in to start working with our teachers and our school workers and childcare workers, we decided to move forward with groups 3. And I'm not sure how many people we have on the waiting list. I think the last I heard it was around 7,000, but there may be more.
Do you know how much
Question?
extra vaccine you've gotten to work with teachers?
Not to date. It's the number of appointments that we can make and the number of people that are still accessing vaccines from groups 1 and 2. We felt like we could begin to move into vaccinating teachers both through the health department as well as both of our healthcare providers. So we're working on that now, and we are having conversations about other potential opportunities for vaccinating where we might be able to request additional vaccine from the state, but we don't have any specific plans on that yet.
Gibby, this is Brett again. I want to follow up on Tina's question, and this may be, again, an impossible question to answer. But last week, Wake County estimated that they still had about 50% of their population in Group 1 and Group 2 not vaccinated yet. And of course, Wake County is about the same size as Mecklenburg County. Do you think that you guys are closer to maybe 30% or have maybe done a little bit better job because of the two big hospital systems here of getting those groups vaccinated? Or do you think that's probably a rough estimate of where we are?
We've been talking about that. We don't actually have an estimate at this point. But the other thing that you need to understand is what we have been seeing in all the groups that we vaccinated, healthcare workers included, is 100% of those individuals are not going to seek vaccine. So we recognize that there's still vaccine hesitancy. Some of those individuals might decide to get vaccinated later. We'll make vaccine available to them then. So we don't actually have a specific percent at this point. What we are recognizing is that we are seeing fewer people seeking vaccine from those age groups, which gives us an indication that many of the people who want to be vaccinated have already been vaccinated. But that doesn't mean that we're still not going to make appointments available to those individuals, and that still does not mean that there aren't individuals out there that need to be vaccinated. So unfortunately, I can't give you a specific percentage at this point.
And to follow up on March 10th, when they open it up for all of Group 3, the grocery workers and the meat processing and everybody, the waiters and waitresses, how much of a burden do you think that is going to put on you guys? Because that's not that far away, and that's tens upon tens of thousands of people that just become eligible.
Yes, it is tens of thousands of people. We are again working with our vaccine partners to. We have a draft plan on how to bite off chunks of that group, because it is a very large group and it's a very diverse group, and we can't get to all of them in the same way. We've got to have different ways of having conversations with those points of contact within those groups and getting their help to let us know how many people are actually in the groups and how best to present access to vaccine to those groups in the most efficient and effective way. So we're working through that right now. What it means is that based on the current vaccine that we have, that it could be months before we get through that entire group. If we see more vaccine coming into the county and find additional ways to get vaccine out, which I think is the federal government's working on that, we're working on that we could chip away at that, and it won't be as long, but it is a very large group and it is going to take some time to get it done.
Hi guys, this is Hi, this is Vanessa with WCNC Charlotte. Feel free to let me know if this is outside your wheelhouse, but I figured I'd ask since we have the experts here. We've been getting some viewer questions, people who have already been vaccinated, so either getting their first dose or they're fully vaccinated, they have their second dose and they didn't quite get the side effects that folks were prepared to feel. And should people be concerned that maybe that means they didn't have a strong immune response? Or do you think that this could just be how it worked out for them and they should still be fine otherwise?
I think that's a really great question, and it's one that we have been asked a lot too. And I think, it's really important to reassure individuals that have been vaccinated that, they should feel confident in the fact that they were vaccinated. We know that vaccines cause side effects, and in particular, the two vaccines that are currently available in the United States, the Pfizer and the Moderna vaccine, have kind of a higher proportion of individuals who have side effects and or more moderate side effects just due to the nature of how the vaccine works. But by no means, and we saw this in the clinical trial as well, that there was a significant percentage of people that also didn't have side effects. And so the lack of side effects does not indicate that the vaccine is not working. It's just everyone responds to the vaccine differently. So people should feel confident that they received the vaccine. But I think I'll also just take the opportunity to remind everybody that we know that vaccines are incredibly important and effective, but it is not 100% effective. So everybody who has been vaccinated, it still needs to take all of the same precautions that Gibby stressed at the beginning of this talk, and really continue to wear masks, wear them appropriately, socially distance, avoid crowded areas, to monitor symptoms, stay home. All of those things that we're asking everybody to do, even individuals who have been vaccinated, still need to do that as well.
Thank you. Thank you for that.
Next question, please.
Hi, it's Claire Donnelly with WFAE. Just one quick follow-up. How are you all trying to make sure people in groups 1 and 2 can still get appointments? I'm wondering if there's some sort of quota or some sort of check to make sure that all the slots aren't filled up by someone, from people all from one specific group.
Yeah, I don't think I'd necessarily use the word quota, but I think it is something where, we work really hard to, as we get, every time we learn how much vaccine that we have, to work to get it out as quickly and equitably as possible. And that is through multiple avenues. So that includes appointments at Bojangles, which is both appointments that we make available online or via our hotline, and then kind of prioritize appointments that we are able to fill. And right now, with focusing on groups 1 and groups 2, that includes appointments at our medic location, that includes some of our community events and our strike teams that go out. So I think through these multiple avenues, we are able to kind of work again to make sure that we have as much vaccine access as available and prioritize those individuals who either, again, fall into groups 1 and groups 2 and or are from populations that have been disproportionately impacted.
Are there any plans to as we move into group 3, to do specific vaccination clinics just for teachers by the health department?
Again, we're doing some planning with both of our healthcare systems to talk through that and to look at what we might be able to do. And if we decide to do that, it would be based on the availability of additional vaccine, which we will be having conversations with the state about. So again, we're still very much in the planning session around that. And hopefully we'll have information out fairly shortly about what we might be able to do to make sure that vaccine is accessible to all of those that work in the school setting, both childcare as well as K through 12, both in CMS as well as in our private sector.
Hi, this is Kendall Morris with WCNC. I saw that Public Health put out a call for community groups and organizations to co-host COVID-19 vaccine clinics. What do you hope to accomplish through these vaccine clinics? And have you had any requests? I know it just came out, but have you had any requests from organizations wanting to do this so far?
Well, what we hope to do with this, again, is expand the availability of vaccine in the community and look at ways and places where we can get vaccine out to those that are most disproportionately affected. And part of that was we were getting a number of requests from folks who were wanting to schedule an appointment at their church, at their business, they had space where they were willing to make it available. So the thought was, let's go ahead and see who out there has an interest and what kind of space they have available, because not all space works well for a vaccine clinic, and to sort of put some sort of structure to that process, since we were just getting individual requests. So we are working with our towns to see if we can get vaccine out into other parts of the county, as well as with our faith community, faith-based organizations, community-based organizations, and others in the community that have appropriate space. And one thing you do need to know is is the state has actually looked at our census tracts and provided us with specific information about census tracts where most of our disproportionate community live. And we're wanting to make sure that we're covering those census tracts and having community-based organizations and faith-based organizations and others who are making themselves available in there will help us with that. So we're looking forward to hearing from organizations who are interested, and whether we'll be able to accommodate all of them or not is dependent on vaccine availability and how many respond. But this gives us an opportunity to make sure that we're in the best places we need to be in the community.
Dr. Sullivan, just real quick, just so I want to make sure that I'm right in this when I talk about this later, because of the weather delays and everything of getting the vaccine. If someone's already had their first vaccine, it does specifically with Pfizer. I know it's 21 days, but if it's 30 days before they get the second one, or 35 or 40, that doesn't really matter, right? Like, it still has the same impact. There's not a certain certain window when you have to get the second vaccine. Am I correct in that?
Yeah, so I think you ask a really good question and a really important point. You know, when people get their first dose of the vaccine, we stress to them to make sure they understand the importance of getting the second dose and the timing of that second dose, depending on, as you mentioned, 21 days for Pfizer, 28 days for Moderna. You know, and the recommendation is to get it as close as possible to that 21 days or 28-day mark. But if you get it a little bit late, that does not impact, you do not need to start the series over, or that the dose is still considered to be valid. The CDC did recently update their guidance and really recommend that people try and get it at least within 42 days of their first dose, again, as close as possible to that 21 or 28 days. But to understand that if there are delays in shipment, right, there are certain things we can't control, and that we don't want individuals to feel panicked or worried if their vaccine appointment is delayed by a couple of days, if they're unable to make it. But we will work as hard as possible to get the vaccine out as quickly as possible. And if we do have to postpone appointments, to get them rescheduled as quickly as possible.
Carrie Simmons here from the South Charlotte Weekly. I have two questions about the next groups of people getting the vaccine. The first question I have is February 24th is when educators will be allowed to get the vaccine. And then March 10th is when frontline workers will be eligible. Is that enough time in between those two start dates for those groups to really make kind of chip away at the need there for everybody to get vaccinated? And then the second question I have is when Group 3 opens up on March 10th, how does the health department in the county plan to verify that people work in these frontline positions?
Yeah, those are, y'all are asking good questions today. So what I can tell you is we are not likely to get all of the teachers and the workers in the schools, as well as the child care individuals, vaccinated within that 2-week period. We will do our best to get as many of them done as we can. And as I said, we're working on the possibility of either some smaller events or large-scale events to work on moving forward with that particular population. We'd love to have all of that done before we move into the March 10th date with the rest of Group 3, but don't anticipate that happening, just as we didn't anticipate having Groups 1 and 2 fully done by the time we move into teachers. So just want to level set with that. And I think like I said, we are working with our partners on how we move into Group 3, the rest of Group 3, with the large groups that are part of that, and looking at creating access points for these different groups to make it more readily available. And we'll work through that with our partners and get that plan finalized over the next little bit before we get to March 10th, so that we're ready to go when we come on that date. But knowing that we will continue to be vaccinating our educators as well.
Okay, last question, please.